Today, we're calling on the UCP to properly invest in student mental health by hiring a mental health professional for every school in the province. Now, I know the UCP are going to say a few things. They're going to claim it's too expensive or that there aren't that many people to hire in this province, but that's entirely predictable coming from a government that constantly has looked for ways to cut and to do as little as possible throughout the pandemic. They set aside $1.25 billion in this year's budget as a contingency fund for COVID-related measures. We estimate our plan would be a fraction of this. Hiring more than 2,200 staff would cost roughly $180 million. This plan is addition to our calls to restore testing, tracing, and isolation so that parents are informed of COVID-19 cases and to ensure that all schools have access to rapid tests, especially in kindergarten through grade 6 classes where the vast majority are too young to be immunized.
In order to protect children's resilience, we must give them the proper supports to process their experiences, the tools for emotional regulation, and access to safe professional guidance in the form of properly trained mental health therapists in every school. The benefit to students and families through supports like this cannot be understated. If we fail to support students through such a significant upheaval in their lives, we are creating generational trauma and lifelong negative impacts.
A lot of us can remember a time where it wasn't abnormal to have a mental health therapist or a school counselor at least available in your school on a regular basis. And it's something that was definitely cut under consecutive Conservative governments. But right now, this year, it's more important than ever. We see students struggling with anxiety and depression, and really a lot of that has to do with the uncertainty that they're feeling. And a lot of parents have reached out to us and said, you know, my child's 10 or 11 and they're not eligible yet to be vaccinated, and that adds even more stress when we're focusing so much on vaccines, and they are of course the best path to protecting oneself, but this isn't an option for 10 or 11 years and that 10 or 11 year olds, and that causes them even more stress when they're preparing to go back to school. We know that teachers and principals and educational assistants do their best to support every student, but we've also been asking a lot of them over the last 2 years. And to give them one more resource in the school, one more expert to be able to support children's mental health, I think is a worthwhile investment.